Well, we can talk now to Ryan Shorthouse, the chief executive of Bright Blue. It's an independent think tank promoting liberal conservatism. Welcome. Thank you for joining us. So just to add into the picture, we have had the Prime Minister's statement this morning telling reporters that the Prime Minister and the Chancellor stand full square behind the plan for introducing the health and social care levy in April. So is any debate around it now a waste of time?
I just don't think it is credible, as some Conservative MPs are calling for, to abolish this tax. 12 billion is needed for the backlog caused by COVID for the NHS, and finally to inject the money which is necessary into social care. To get 12 billion, you need tax. And you can only really get that amount of money through one of the three big taxes: national insurance, income tax, or VAT. The government has chosen national insurance. The Labour Party is talking about, okay, maybe we should be applying it to wealth taxes like capital gains or inheritance tax. No way are you going to be able to raise 12 billion from that. So I just don't think it's credible to abolish it. And I think the Treasury is right to resist that. Some people have said, let's postpone it. The problem with postponing it is that we know that interest rates are rising. The government's debt, the servicing of that debt, is becoming more expensive. So for the government to postpone it and therefore require more borrowing is something that also the Treasury will resist. And politically as well, the Chancellor will want to take the pain now so that he can give more giveaways near an election.
You've said that the government should widen the base of the levy to bring in rental income and pensions. Can you explain how much more that would bring into the pot, what it would do to the overall picture?
Yeah, although I think the Treasury is right to resist abolishing or postponing it, I don't think we necessarily have to continue with the status quo. So I think we can go for a reform option, which is that you broaden the base, so you apply this health and social care levy to pension income and to rental income. At the moment, it applies only to earnings and dividends. So we're going to broaden the base. That will bring more money in. And if you do that, you will then be able to cut the rate, the 1.25%, which is applied across both employees, self-employed, and employers' national insurance. So you reduce that headline rate, and therefore the kind of twin-fold effect of that. The first is that you're sharing the burden of this taxation across a wider group of people, across both older people and wealthier people. But the other effect is that you're kind of reducing some of the sting on employment effects and household income by reducing the headline rate.
And what would the headline rate be able to reduce to raise the same 12 billion?
Well, I think, you need to look at I can't give you an exact figure there, because you need to look very carefully at what the costs will be, or the revenue raising implications of bringing in both pensions and rental income. And then from that, you'll be able to decide how much you'll be able to cut the health and social care levy rate by. And if I was going to prioritise, I would start with the employers aspect of the health and social care levy, as opposed to employees and self-employed. The reason for that is because, particularly as there's so much upward pressure on wages at the moment, it's likely that will allow companies, that cut for employers will allow companies to service those higher wages. And at the same time, what's happening is the tax take from employees and self-employed is continuing to widen, and there's all sorts of perverse incentives to try and incentivize people, therefore, to go into self-employment as a result of that. So actually, I think focusing on the employer's bit of health and social care levy would be the right thing to do in terms of reducing the rate.
Ryan Shorthouse from Bright Blue, thank you.